The CDC is no longer recommending universal contact tracing, a measure that many health officials relied on to track COVID outbreaks and try to keep numbers down. The decision was made in part by the overwhelming Omicron surge. Agencies just could not keep up with testing results. The CDC also found COVID testing was no longer an effective tool to track outbreaks. The move comes as the White House COVID task force unveils its plan to turn the corner in the fight against the pandemic. The plan focuses on treating cases and preparing for new variants while also avoiding shutdowns. Let's bring in Dr. Bob Lahita for more on this. He's a professor at the Hackensack Meridian Medical School and the director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health. Dr. Bob, always good to have you with us. Walk us through this decision to stop contact tracing. What's the CDC going to focus on instead, and what does this mean for everyday testing?
Well, people are testing at home now. Many people have been vaccinated, over 75% of the population. And so we don't know who is positive and whether those positive people will ever be known to anybody, unless you wind up in the hospital or in the intensive care unit, Joe. So the CDC is now concentrating on things like sewage examination to see whether there are any blips or any new variants with genomic testing. There's been new funding for genomic laboratories. And that's the direction that we're going in at the present time.
I want to ask you about the World Health Organization. It says pregnant women in the Americas have been disproportionately affected by COVID. Their mortality rates are significantly higher compared with the rest of the world. So now that the virus is receding in the U.S., how important is it that we focus on family planning services and women's health? How do we get more people to resume some of their routine care?
Well, Joe, women do generally better than men when they get infected with COVID. But in the Americas, and that's the Caribbean and Latin America, the 72% of those patients were women who were pregnant, and there were social factors that prevented them from getting prenatal care, et cetera, because they were infected, and the agencies that did that kind of care weren't interested in treating them. So about 3,000 out of 365 of those women died in the Americas. And actually, that's one of the parts of the world where there's a bump up, like 16% increase in infections in Jamaica, Trinidad, countries like Tobago. So it is a big problem, and that we shouldn't be complacent and think that the rest of the world is going down in infections like we are here in the United States.
Finally, Dr. Bob, I want to ask you about Virginia Senator Tim Kaine. He revealed he's suffering from long COVID symptoms and has been doing it for 2 years since his diagnosis. He's now introduced a bill to fund research into the long-term effects of COVID and expand treatment resources. How important is this to help us better understand this mystery of long COVID?
This is really extraordinarily important, and it's also scientifically and medically fascinating, Joe. First of all, long haul COVID consists mostly of muscle aches, fatigue, shortness of breath, brain fog, a bad rash that goes on and on and on. 35% of those with COVID have not fully recovered after 3 weeks. 10% go way beyond 3 weeks, and less than 10% go on for years. So you lose your taste, you lose your smell. It's a chronic, complex, multi-factor condition. And we in medicine have all asked, what is the reason for this occurring in certain people, but not everybody? And it favors men in particular, because men seem to suffer greater. As I told you in the past note, that men tend to get COVID in worse form than women. So this is a big issue.
Yeah, those are big numbers and something we're going to be wrestling with for quite some time. Dr. Bob Lahita, as always, thank you so much.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.